Welcome to week 4. So, we are moving closer to the end of the course as week 5 next week is our final week of the summer course. So, again, I just want to say thank you all for an amazing course and being amazing students. So, for week 4, we are discussing family and addiction and also trauma and addiction. So, for the brief lecture this week, we're going to start with family and addiction. So, addiction is often called a family disease. And this is not because it's contagious, but it's because it affects every member of the household. So, addiction disrupts trust, communication, routines, and roles within a family. So, over time, families adapt in an effort to survive the chaos. And when they adapt, they often form these patterns that enable the addiction or suppress open acknowledgement of the problem. So, families may end up feeling like they're walking on eggshells. Some members may take on more responsibility to overcompensate. Others might rebel or withdraw from the family. And these adaptations aren't random, they're shaped by emotional survival. So remember that. So just always remember when you see these adaptations, it's because the family members are trying to survive emotionally, right? And so what we commonly see is different family members take on different roles. So in families affected by addiction, these roles tend to emerge. So when you're working with individuals, you may see this, right? Because as we know, if you're working with individuals who are headed towards recovery, family is important, right? Family can play a huge role in their recovery and also in their treatment. So while every family is different, these roles offer a helpful framework for understanding common patterns. So here are 6 often identified family roles. First, we often have what they refer to as the addicted person or the person who's addicted to substances or addicted to a process addiction. So this individual's behavior is the central source of stress and instability in the family system. Then we have the enabler or the caretaker. So this is often the partner or parent or the sibling or another family member who tries to hold it all together. This person shields the addicted individual from consequences and often unintentionally prolonging the addiction. Third, we have the hero. Now, the hero is typically, like I said, doesn't have to be this way, but I'm just telling you what the literature typically states that usually the hero is the oldest child. The hero works hard to achieve and appear perfect in order to distract from the family's dysfunction. They often carry anxiety and responsibility beyond their years. Fourth, we have the scapegoat. This is the person that may act out, they may break rules or cause conflict. They draw attention away from the addiction and absorb the family blame. Then we have the fifth, we have the lost child. This is often the quiet, invisible, and emotionally distant family member who tries to stay out of the chaos and avoid being a burden. And then we have, lastly, the mascot. Some people refer to it as the clown. You'll hear it in both. It depends on who's writing, which researchers are writing, or who's discussing it. They'll say the mascot or the clown. And this is often the youngest. Again, it doesn't have to always be the youngest, but often is the youngest. This person uses humor and playfulness to ease tension and deflect pain. So, again, these roles are not rigid and they can shift over time. But what's important to understand is that these behaviors are coping mechanisms. They may provide short term relief, but often create long term emotional wounds. So, next, we're going to move on to talk about addiction and trauma. So, now let's explore the connection between addiction and trauma. Many people with substance use disorders have experienced trauma, such as physical abuse, sexual abuse, neglect, domestic violence, or the chronic instability of growing up in a household affected by mental illness or addiction. Now, I want to say, and I want to stress this part. Like I said, many people with substance use disorders have experienced trauma. That does not mean that every individual who has a substance use disorder has experienced trauma. So that is often a misconception that some people come in with, and you'll hear people misquote that. They'll say that everybody has a substance disorder has experienced trauma. That is not always true, So we can say that many people do, right? Because literature has found that, but we can't say that every person has, right? So again, I'm going to repeat this part. Many people with substance use disorders have experienced trauma, such as physical abuse, sexual abuse, neglect, domestic violence, or the chronic instability of growing up in a household affected by mental illness or addiction. And these are often referred to as, I know I saw in some of your discussion board posts, seen this reference. So these are often referred to as adverse childhood experiences or ACEs. And so trauma affects the brain's stress and reward system. It can lead to hypervigilance, emotional numbing, and difficulty regulating emotions, all of which increase vulnerability to substance use as a form of self-medication. Now, importantly, addiction can also create new trauma, right? So when addiction creates this new trauma, that means that the person using substances and for those around them, new things may occur, such as overdoses, incarceration, emotional abuse, and family ruptures can leave lasting scars. So, I've said a lot about trauma. So, I want to make sure we're all on the same page. So, what is trauma? Trauma is not just what happens to a person. It's how the nervous system responds when an event or a series of events overwhelm their ability to cope. So, trauma can be acute, like a car accident or natural disaster. Trauma can be chronic, like ongoing abuse, neglect, racism, or living in a violent home. Or trauma can be complex, which means involving repeated relational trauma, often beginning in childhood. So, trauma affects how people think, feel, relate to others, and regulate their bodies. It can lead to anxiety, depression, hypervigilance, emotional numbing, substance use, disassociation, and a distorted sense of self or safety. But trauma is also about context. So the same event may traumatize one person, may not traumatize another person. So it depends on the history, the support system, the age, identity, and resources. So this is why it's important that we always look at the cultural context, someone's individual history, to understand how different individuals can experience the same thing and may not feel traumatized. So we also can't always assume that someone feels traumatized because of a particular thing that happened to them. And we just have to be mindful of that. So again, remember, trauma is about context. So now we're going to talk about connections between trauma and family addiction. So when trauma and addiction are both present, they often reinforce each other in this cyclical pattern. So trauma can lead to substance use, and substance use can deepen traumatic experiences, right? So again, I'm gonna repeat that trauma can lead to substance use, doesn't mean it always does, but it can lead to substance use, and substance use can deepen traumatic experiences. So children raised in households with addiction may not only develop trauma-related symptoms, but they may also carry forward the same maladaptive coping strategies into adulthood, including substance use. So, this is where intergenerational trauma comes in. And this is when trauma and addiction ripple through families and impact not just one generation, but multiple generations. So, what exactly is intergenerational trauma? So, intergenerational trauma refers to the transmission of traumatic experiences and their emotional, behavioral, and relational effects from one generation to the next. And this can happen in several ways through family patterns like secrecy, silence, addiction, or violence, through epigenetic changes where trauma affects the gene expression and stress responses, and through cultural and historical oppression such as colonization, slavery, genocide, displacement, and systemic racism. Um, And so it's important to point out that children of trauma survivors may experience increased anxiety or emotional dysregulation, confused roles and boundaries, lack of secure attachment, and an unspoken but deeply felt sense of fear, shame, or instability. So intergenerational trauma is often invisible, but its effects are real and far reaching. So now we're going to talk about treatment, challenges, and protective factors. Treatment for individuals and families affected by addiction and trauma must be trauma informed. It must also be culturally responsive, which means that we're looking at understanding the individual's cultural makeup, right? And it also must be inclusive of the entire family system when appropriate, right? We don't want to bring the entire family system in if it's not appropriate, if it's not going to be helpful to the client or the consumer or the patient that we're working with. So we're only bringing in the entire family when it's appropriate. So I'm going to repeat that again. Treatment for individuals and families affected by addiction and trauma must be trauma informed, culturally responsive, and inclusive of the entire family system when appropriate. So I've mentioned trauma informed treatment or trauma informed care a couple of times. So, what is trauma informed treatment? It's not really a specific technique, but it's a philosophy. It's a philosophy of care that recognizes the prevalence of trauma and responds with safety, trust, and empowerment at every level of service. So, if you're going to be a trauma informed provider, you must always assume that trauma is present, even if it hasn't been disclosed. You must prioritize safety and choice in all interactions. You must avoid re traumatization, like using shame, power over dynamics, or triggering environments. And you must view behavior as adaptive and not simply pathological, right? And so, what that means is we're not looking to always pathologize someone's behavior, right? We must understand that behavior can often be adapted to a situation and a way to cope, right? So that's what I need you to understand. And also, trauma informed treatment applies to individual therapy, addiction treatment, school counseling, healthcare, and beyond. It also involves understanding intersectionality, and it recognizes that trauma can be compounded by racism, homophobia, poverty, ableism, and other forms of systemic violence. So, what are some key components of treatment? So, individual therapy for trauma, grief, and addiction recovery, family therapy to address communication, boundaries, and unresolved pain, psychoeducation about trauma and addiction cycles, group support like Al Anon, ACA, which is short for Adult Children of Alcoholics, or family focused rehab programs. Now, what are some challenges? So, challenges include denial or minimization of addiction within the family, interpersonal resistance or conflict in family sessions, deep rooted shame and secrecy, lack of access to family inclusive care or trauma specialist. Okay, so now we said the challenges. What are the protective factors? So the factors are elements that can help heal families. So we're looking at stable, nurturing relationships with at least one safe adult, cultural or spiritual grounding that offers meaning and support, opportunities for open, honest communication, early intervention, especially for children in high risk environments. And so we must always remember that resilience is possible, healing is possible, and families can grow stronger, not by ignoring the pain, but by working together, working through it together. So I have some reflection questions. Again, not for you to respond to, but just for you to think about, right, as you kind of grow and develop. So, one reflection question is: how might my own family system or upbringing shape the way I understand addiction and roles within a family? Secondly, what are some ways I can approach family members in treatment with compassion, even when their coping behaviors seem dysfunctional? And lastly, how can trauma informed care shift the way that I support clients, consumers, or patients with addiction and a history of family pain? So, to sum this all up, addiction affects families, but families can also be a part of the healing. So, with awareness, support, and space to change, recovery becomes not just possible, but powerful. And also, if we're talking about trauma, remember that trauma is a wound, emotional, psychological, or somatic, and that disrupts a person's ability to feel safe or whole. Intergenerational trauma is the wound that is passed on, often silently, but through families, communities, and culture. And trauma informed treatment is a healing approach that starts with compassion, curiosity, respectful curiosity, right? And the belief that people are doing the best they can with what they've survived. So, again, that was just a brief overview of our topics for the week. So, you have three assignments this week. Your first is a discussion board prompt that is going to focus on family trauma and addiction. So you're going to respond. I think it's four questions here, but you're only going to ask to respond to two to three of the questions. Then you have two assignments. If I can find them here, sorry. Um, you have two assignments for the week. I thought I had them pulled up. Give me 1 second. I think one is a case study. I am so sorry. I thought I had these pulled up for me. Okay, here we go. Um, And let me get to week 4. Here we go. And so your first assignment is about family systems and roles in addiction households. And so for this one, you're doing a 3 to 5 paper that responds to the following prompts. And so you're going to respond to the prompts. And then you're going to also have a case application. And let's see, the final assignment is, I think I scrolled by it. You're going to be doing a visualization between the link between to link between trauma and addiction. So you're going to create a visually engaging educational tool such as an infographic, a poster, or a short slide presentation. And so all the information is going to be listed there for you in Canvas. And so, as always, I hope you all have a great rest of your week. Please reach out if you have any questions, comments, or concerns. If not, I will look forward to continue reading your assignments and take care. Do something for you.